Yeah, the PACIFIC trial is a single-center comparative multimodality imaging study where we compared CT imaging with SPECT imaging and PET perfusion imaging of the heart, and all patients were subsequently referred to the cath lab with fractional flow reserve measurements of all coronary arteries. And the purpose of the trial is to determine which of the imaging modalities has the highest accuracy for the detection of functional significant disease, and whether the addition of CT to SPECT or PET to get a hybrid approach, whether hybrid imaging has a higher accuracy compared to standalone imaging. What we were hoping to understand and what our primary hypothesis was is to find out which imaging has the highest diagnostic accuracy, and we hoped that SPECT CT using an attenuation corrected SPECT would have would be similar to PET imaging in terms of accuracy. And if that was not the case, we hoped that the addition of CT to SPECT would yield an accuracy which was similar to PET alone, because PET is not generally available and SPECT is, so it's already a well-validated, widely available modality. So that was the primary hypothesis of our study. Yes, there is, especially when it comes to PET imaging. We use oxygen-15 labeled water as a perfusion tracer, where in the United States they usually use rubidium PET, and there are a lot of differences between rubidium PET and oxygen-15 labeled water PET, especially when it comes to quantification of perfusion. So that's one of the major differences between Europe in this case and the United States. But with regard to SPECT imaging and CT imaging, it's the same. Yeah, because oxygen-15 labeled water is not FDA approved in the United States for some strange reasons, but it's approved in Europe, obviously, and in the States they use rubidium. But an advantage of rubidium is that you don't need a cyclotron. It's on site, available on site, and you can inject it into the patient immediately. And with oxygen-15 labeled water, you need a cyclotron to produce the oxygen-15 labeled water tracer. We included intermediate patients, or patients with an intermediate pretest likelihood as defined by the Diamond and Forrester score, and patients without a prior history of coronary artery disease. The PACIFIC 2 is on its way right now. With the PACIFIC 2, we investigate patients with a prior myocardial infarction or with a prior history, if you like, and to determine what imaging has the highest accuracy. In that study, we don't use CT imaging. We use MRI, SPECT, and PET perfusion imaging. Just looking at perfusion, because in patients with already a myocardial infarction or with a prior history of coronary artery disease, we already know those patients have coronary artery disease as determined by anatomical images as CT. So that's why we're not performing CT in those patients, but only stress imaging. What we found is that SPECT, which is widely available and used in almost every institution for the evaluation of myocardial perfusion, that SPECT had a very low sensitivity of only 57%. That's something which has never been published before. Because the majority of prior studies used invasive coronary angiography as a reference standard, while we used fractional flow reserve measurements of all coronary vessels irrespective of the imaging findings. And we found that SPECT has a very low sensitivity of 57% only. So if you have to choose between CT and SPECT imaging, you would definitely choose for CT imaging in patients with an intermediate pretest likelihood, which is not recommended by the guidelines right now. CT is in fact not recommended in patients with low risk or in patients with an intermediate risk according to the ESC guidelines. But with this study, hopefully CT will get its place back with regard to the diagnosis of disease in clinical practice.